everyone. We are so excited to have you all here. We would like to have a special introduction to our board and to other guest members today. We are the Hillsboro Home County Health Agency, and we are here today to talk about our strategic plan going forward. We are very well established in our community. We're very well known. We offer a variety of services at a very high quality of care, and so we are very excited to stand here today and talk to you about it.
In the next 10 years, Middleborough will be facing an aging population, and they'll be facing a rise in the uninsured due to economic stagnation. Almost 40% of the population right now is over the age of 45, and there's been a 19% rise in the uninsured due to a reduction in employment coverage. Due to this aging population, chronic conditions are expected to be the most prevalent. Heart disease and cancer are the number 1 and 2 causes of death in Middleborough. And diabetes has risen 18%. Over half of the population is either overweight or obese.
As Ms. Garner mentioned, an increase in the aging population will increase the prevalence of chronic conditions. Because of this, health services such as long-term care, hospice care, and chronic care management will be crucial. Additionally, the Middleborough economic status is currently stagnant and may even decline due to the growth in Jasper. And because of that, we foresee an increased need of community health services in Middleborough to help promote the health of the community.
So I want to talk to you a little bit about what our population health focus is right now currently, and what it's been in the past, and then Ms. Yackel will differentiate that with how we're going to do in the future, and maybe some things that are changing and some things that we want to sustain. So right now, our current focus is really just on Middleborough. That's the only area that we've been focused on. We have some current services like our education. We talk a lot about nutrition. And then we have health screenings like blood pressure screenings, those types of things. We do those in the public areas, like in our churches or schools, those types of areas. We have some senior health clinics that we offer, and with those things we do some foot care, we do some injections for our patients, and then we have community health activities. This is a wide range of things, so I won't give you the exhaustive list, but we do physicals, we do drug screenings, those types of things.
Board, I would just like to say I'm so sorry I forgot to introduce ourselves. We were so excited to talk about our strategic plan. So with us here we have Mr. Oguhebe Jr., we have Mrs. Carl, I'm Ms. Yackel, we have Ms. Delaney Garner, Ms. Allen, and Mr. Madston. So now I'm going to kind of talk more about the future and where we want to go. Even though we are Hillsboro named, we really focus more in Middleborough. We do have an office in Jasper, and however, we are planning on closing this office due to the fact that it is not operating as efficiently as it could, and it is not operating at a profit. This is not benefiting us, and it's also not benefiting the populations that we are trying to serve. So secondly, we are going to expand our services. So we are going to do this in increasing our continuum of care through the creation of a hospice in Jasper. We have received feedback from people that, from the aging population, that they would really like a presence of a hospice there, and so we have done a deal in order with Jasper Gardens, or the gardens at Jasper, in order to provide this, and that will help to target our aging population and to give them the care that they deserve. Secondly, we are going to renew emphasis on our community health center. So we are going to create a community center, and this will help to be the base for our education programs. We are very strong in our education programs. We do a lot of things out in the community that Ms. Allen talked about. So this will be the base and the way for us to increase population health and to increase the overall health of our communities. And now Mr. Madston is going to go into more details about both of these ventures.
Jasper has land available. Webster has the capital to provide a physical facility for us to operate a Medicare hospice on the grounds, the details of which we will be paying a lease to Webster, and 15% of our revenues will be going to Jasper. We'll be maintaining the other 85%. In addition to the actual facility, we have EHR compatibility. So this is really for our patients. We want the continuum of care to go from nursing facility to long-term care to home health to hospice and potentially inpatient acute care visits at Webster. And then finally, transportation services. So this is a smaller piece of the collaboration. What we want to do is for our patients who are in home health, we want to have easy transportation for them to go back and forth without having the expenses of ambulance services. The next piece, the community health center. Community health
mission in the our overall mission is to increase the population, the health of the population in Hillsboro, especially in Middleborough. To do this, we believe that we need to stay very close to ensuring that our education services are still continuing, because that's what we're known for. We've been there for a long time. The community believes in us as, as more of that go-to um, healthcare system or healthcare community that they can go to for a vast majority of healthcare needs without going to the hospitals or going to the different other facilities. That's why our strategy with the different with Jasper, Gardens at Jasper, and Webster Hospital is very key. It's important to us. With the community health center, establishing we can be able to establish this community health services in the community, not only because, as Mr. Masden has explained, we are losing funding from that. Funding majority comes from grants. And that's something we believe in because we can give to the community without really worrying about the profit, this, that. So the collaboration to build this community health center gives us a way to increase the funding or be able to get more funding for these services. Now, in Middleborough, we have it as the main place for this building. Offer those services. We have the education, the OT, the PT, and all the other services that we provide initially. And in Jasper, instead of having a base there, we'll actually continue what we used to do, which is to go out to the different communities and the different centers like the schools to do that. But we'll have that at Middleborough as the main base. That strengthens our relationship with Webster Hospital, and it bolsters our viability in the community. Because they still see us as the first line in entering that continuum of care. So that's one key thing about having the community health center. The three-way joint venture to build the hospice is very important to us also, because as many of us explained, is something that the community wants. And we pride ourselves in being able to say we can offer that to you. So while making our decisions, we really made sure that whatever partnership that we made is not limiting the ability of the community people to come to us for care. So that's why when we build the hospice center is to accommodate those needs. Now, assist in the care of the aging population, as Ms. Garner has explained. The aging population is continuously increasing, and with the intermix of several chronic conditions, having a hospice care will be able to more accommodate those and care for those patients in their last days. Now, will be a key contributor to building the first hospice care, and that means a big deal to us because it will put our name in the minds of the community. In our partnership, we make sure that we will have our names under the different titles as a way to increase our footprint and our face time in the front of the community. And it will foster a growing relationship with Webster and the Gardens, and it will expand the current services that we have and help us garner the funding to keep maintaining the services that we have already. Any questions?
Why just a Medicare hospital?
So is it only for Medicare?
So we had a consulting firm recently had a report that Medicare certified hospice was the entity that's going to be viable in the community. And that, in combination with bad press recently that there isn't one in the community, partially we were to blame because we didn't partner with existing hospices now in business a few years ago. Specifically, it was mentioned it would be a Medicare hospice.
And also with the move of the population from Middleborough to Jasper, typically more age population want to be in a more quieter scene. The move from population from Middleborough to Jasper allows that hospice in Middleborough to be more viable for those people. population, so much traffic, then put it in Middleborough, because that's the better way to serve.
So you're emphasizing your role in Middleborough, anticipating that with population shift, the hospice care will be more needed in Middleborough than Jasper?
Right.
Because you're closing your office in Jasper, is that correct?
Yes, we're closing the office in Jasper, but we still maintain the presence with our presence with the community health center, which is going to be in Jasper. So while we're closing the hospice or the office in Jasper, which was our previous presence there, now we're bringing the community health center there. We still maintain, in case we should move in there at any time, we still will have a presence there already to be able to facilitate that.
Can you talk a little bit about the community health center and specifics of kind of what it's gonna consist of?
Well, yes, I apologize. Yes, it is. It's in Middleborough. I apologize. But it's going to encompass the PT, the ST, and all the other stuff. But at the same time, it's going to offer education. It's going to be like more of the face for the people to come in for like different education they're already doing. So it's going to kind of encompass a broad range of things plus that. So, but it's going to.
Educational services that I mentioned are all ones.
Yes.
Our hope is we're already a community leader in community health. We get the most funds of anybody from the legislator in this regard. We're hoping that by having a home, which is provided on the whole campus funded by Webster, that is going to increase that because we aren't in the black yet. We think that with this new physical facility to operate those community health initiatives from, if that will, this capital is provided for us, that'll help that initiative.
It'll be grant funded, so. I just want to be clear, you're going to build a new building for your hospice patients?
To be clear, Webster.
Webster is building.
Webster is going to build a new building for the hospice patients.
On
Jasper
justice.
Gardens.
So yeah, we're gonna run that. Getting the 85%